Hi, I'm Dr. Leah Hill with Pet Products. Today we're going to talk about CPR. The main components of CPR is ABC, airway, breathing, and circulation. So the first thing you want to check is your dog breathing? Checking for the rise and the fall of the chest. You can also put a tissue in front of the nose to see if there's any movement. If there's no breathing, you want to vigorously move your dog around, call its name to see if there's any response. If there's no response, you want to check the airway to make sure there's nothing obstructing it. So extend the head and neck. You can open the mouth and pull the tongue down and look and make sure there's nothing that's obstructing the airway. In small dogs and cats, you can use one hand to kind of close their mouth and the other hand to go over their nose. And you want to take 2 breaths. And you should be able to see their chest rising and falling. In big dogs, it's hard to use only one hand to close the mouth, so you'll want to use both hands to close and then go directly onto their nose to do the breaths. The next thing you want to do is to check to see if they have a heartbeat. On most dogs, if you flex the elbow, wherever the elbow hits is usually where their heart is located. So when you flex their elbow, go ahead and use 3 fingers on the chest to see if you can feel the heartbeat. The other alternative is to look for the femoral artery, which is on the inside of the thigh. So if you lift up the leg and feel right in this groove here, you can feel the beat of the heart. The next step is compressions. So now that you know where the heart's located, you want to put the heel of your hand right over that where that heart is and use your other hand and interlock your fingers. Keep your elbows straight. You don't want to really pull your whole body weight. You want to just go straight down, about 1/3 to 1/2 of the way down. Depending on the dog breed and size will depend on how you perform CPR. For Labradors, Pit Bulls, kind of larger breed dogs, you want to perform CPR right on the middle of their chest. If you have a barrel-chested dog like a bulldog or a pug or those type of breeds, you want to perform CPR with them on their back, so you're going straight over the chest this way. For narrow-chested dogs like Whippets or Greyhounds, you'll be performing CPR right over their heart, so in this location. And for small animals like cats or very small dogs, you'll want to use your hands to perform CPR by using your hands and pressing like this. If you're performing CPR by yourself, you'll want to do the chest compressions first and the breaths. So do 30 chest compressions followed by 2 breaths. 30 chest compressions, 2 breaths. After 2 minutes, you'll want to check again to see if they're breathing or if they have a heartbeat. With chest compressions, you want to perform 100 to 120 compressions per minute, which actually goes along with the song Staying Alive. If you have 2 people doing CPR, one person can do the chest compressions while the other one can do the breaths, and it's 10 nose to mouth breaths per minute. After doing a round of 2 to 3 2-minute cycles, if your dog is still not breathing, you want to get them to the veterinarian straight away.